Many times while eating, you might have accidentally swallowed a tiny stone. Haven't you? Are you one of them who worry about getting kidney stones by accidentally eating stones in your food? If you also think like that, this video is made for you. By the end of this video, you will know how kidney stones are formed as well as consequences of eating stones accidentally in your food. Now, let's know how these stones get formed in your kidneys. Look at these focused organs. This is the location of your kidneys. Your kidneys work hard to filter waste and excess of minerals from your blood. But sometimes, certain substances that passes in the urine become too concentrated and start forming crystals. Over time, these crystals in your body may clump together and turn into kidney stones. Look at this increasing concentration of blood. Different chemical substances like calcium, magnesium, uric acid, and cysteine are accumulating here. Over time, this accumulation leads to formation of different type of kidney stones in your body. Now let's know what are the different type of kidney stones and what kind of disease and disorder may lead to stone formation in your kidneys. As you can see here, there are 4 types of stones that may get formed in the kidneys. Number 1. Calcium stones. Struvite stones number 2. Number 3. Uric acid stones. And number 4. Cysteine stones. Now, at first, let's talk about the calcium stones. As you can see here, this is what calcium stones exactly looks like. This is the most common type of stone that may get formed in the kidneys. So, what are these stones made of? By the name calcium stones, these stones are composed largely of calcium oxalate or calcium oxalate mixed with calcium phosphate. As you can see here, there may be number of causes for the formation of calcium stones in the kidneys. Hyperparathyroidism, in which the levels of parathyroid hormone is high in the body. It may lead to calcium stone formation in the kidneys. Other causes include diffuse bone disease, sarcoidosis, other hypercalcemic states, and also hyperabsorption of calcium from intestine. All these factors lead to increase in calcium level in the blood, which is termed as hypercalcemia. Consequently, hypercalcemia leads to hypercalciuria. Hypercalciuria is the increased concentration of calcium in the urine. Mainly, increased concentration of calcium in the urine leads to the formation of calcium stones. It is the most common type of stone, which accounts for 70% of all renal stones. Other causes of calcium stones can be hyperuricosuriia, that is, increased uric acid level in the urine, in 20% of the cases. Hyperoxaluria, increased oxalic acid concentration in the urine, in 5% of the cases. And hypocitraturia, that is, decreased citric acid level in the urine. This type of calcium stones forms in the acidic medium. In this way, high calcium, presence of nucleating factors, and absence of anti-nucleating factors like citric acid leads to calcium stone formation in kidneys. Now, let's talk about the second most common type of stone, which are struvite stones. This type of stone accounts for 5 to 10% of all kidney stone cases. This type of stones are also known as magnesium ammonium phosphate stones or triple stones. So, how are these struvite stones formed in the kidneys? Let's talk about that. As you can see here, the struvite stones are formed in the alkaline medium. Urinary tract infection caused by urea-splitting bacteria such as Proteus and some staphylococci converts urea to ammonia. This formed ammonia results in alkaline urine that causes precipitation of magnesium ammonium phosphate salts, leading to formation of struvite stones in the kidneys. As urinary tract infections are more common in females, females are more prone to get this type of stones, that is struvite stones. Sometimes, struvite stones form some of the largest stones in the kidneys. So, this type of stones are called staghorn stones or staghorn calculi. You can see below the picture of staghorn stone. Staghorn stone occupies large portion of the renal pelvis and are frequently a consequence of infection. Now, let's talk about the uric acid stones, which accounts for 5 to 10% of all cases of renal stones. These are the large stones. You can see the picture below how the uric acid stones exactly look like. Now, how are these uric acid stones formed? This type of stones are formed in the acidic medium. By the name uric acid stones, these stones get formed when the level of uric acid rises in the body. For example, in gout, in blood cancer, that is leukemia, involving the rapid cell turnover. This type of causes leads to hyperuricemia, that is increased blood level of uric acid, and hyperuricosuria, increased urinary concentration of uric acid. So, these factors leads to uric acid formation in the kidneys. So, if you are having high uric acid levels in your body, you should be aware and conscious about the formation of uric acid stones in your kidneys. Now, let's talk about the another type of stone, that is cysteine stones. It accounts for 1 to 2% of all cases of renal stones. You can see the picture of cysteine stones below and realize how the cysteine stones exactly looks like. How are these cysteine stones formed in the kidneys? Such type of stones are formed at very low urinary pH or highly acidic pH. The major pathology behind the formation of cysteine stone is the genetic defect in the renal reabsorption of the amino acids, including cysteine. This leads to passage of cysteine in the urine, which is known as cysteinuria. So when the excretion of cysteine in the urine becomes excessively high, this leads to formation of cysteine stone in the kidneys. This is all about the different type of kidney stones that may get formed in your kidneys if you have certain type of disease and disorders. Now, let's talk about what happens when you accidentally eat stones along with food. Does it lead to formation of kidney stones? Well, the answer is no. When you swallow a tiny stone, it doesn't go to your kidneys. It follows the digestive tract. First, it passes through the esophagus to the stomach. Since our stomach is unable to dissolve the stone, it passes without any change in the stools. Most of the time, small stone pass through the digestive tract without causing any trouble. But if you accidentally swallow a large stone, it may cause obstruction of different part of GI tract, and you may require surgery. So be careful. Thank you for watching this video. For more informative video like this, please subscribe my channel.